Myrna and I are now going to move to our panel discussion. So if we can bring on our panel through modern technology, and voila, in both languages, voila, our panel is here. We've given the panel a challenge because we wish we had all day, but we're going to do the best in the time we have. And Myrna and I have two questions. I'll start with the first question, and we'll go around and hear from everyone. So, what's working well, or what needs to change, and also any success stories? So, just a very broad question on things that you're proud of, or things that you think need to change. And maybe Deidre, if I can start with you from the Ontario perspective, since you're the oldest Death Review Committee. Even though you're old, you're also going through a lot of changes. So lots of years to reflect on, and also thinking about the future. I think you might be muted. Okay, we're going to. I think we're having some sound problem with Deidre at this point, so maybe I'm going to put Emily on the spot. Emily, could I ask you to think about those questions? What's working well, or what needs to change from your perspective in New Brunswick?
Sure. So one thing, can you hear me fine?
Yes.
Yeah?
Yes.
Okay. So one thing I find that's working well for our committees, we do have a multidisciplinary committee. So we have experts from every field of expertise. We have people in management position with the government. We have scholars. We have some frontline workers. So I think that really brings a different perspective, different knowledge, different experience to our committee. Another thing that I find is working well for us is we do get in contact with the family of the victims. And we're pretty flexible on how they want to participate for a review. So I offer them the option of either just speaking with me on the phone. We have a special form that I can send out if they just want to write, or they can come and meet with the committee itself, answer our questions, have a discussion with us. Another thing that we have found works well is we have a specific form for our coroners to help them guide their investigation when they do response to domestic homicide. So that helps bring more pertinent information forward for us. So when we do a review, it's a little bit more complete. We've also, one of our success stories is during the pandemic, we've adapted very well. Our committee was very flexible. We were able to continue our reviews monthly, sometimes twice a month we would meet. We would do it on Skype. We would share that information that way. So the pandemic really hasn't slowed us down much. And I think that's a little bit it for what's working well for me.
Okay. Laurie, I'd be interested in your perspective on that first question. I know BC has a unique model in the sense that you've done 2 major reviews of a number of cases. So it's not an ongoing committee, but there's still been a major contribution in looking at domestic homicides in BC. Can I get your reflections, Laurie, on what do you think working well or what needs to change?
Promoted me to head of the specialized investigation death review unit here at the BC Coroner Service, and I'm actually a coroner within that unit. But thanks for the pat on the back. Yes, we do we've had the 2 reviews, so we are more in the camp of every few years as opposed to ongoing review. And what works well for us is that we have an established death review team within the coroner's service, a data analyst, a researcher. We draw in then a specific a coroner who does investigations in the related field. So we've got a good system for aggregate reviews. We draw on subject matter experts, others in the community, stakeholders involved. It's a very collaborative process as far as reviewing the data that is compiled and put together by the researcher and our analyst. And it's a very collaborative, iterative process as far as coming up with the recommendations. So they are really recommendations that are workable and feasible because the stakeholders are going back to their agencies as a part of that process. So when the recommendations do come out, my sense is that there is a lot of buy-in, that they are well respected and meaningful. It also has been very important, I think, that review process, or has been helpful, very helpful in creating a really good foundation for ongoing relationships between the different agencies and stakeholders involved, and out of that death review panel process, I know there have been working groups and towards implementation of recommendations and that sort of thing. In terms of challenges, because it's a different process in terms of reviews every couple of years, and we're relatively new at that, I think it's maybe a little early to say what our challenges are. So maybe I'll leave it at that. Or did you want to hit success stories in the same point?
If you can include a success story.
I think a success story is in terms of our internal process at the Coroner's Service as a result of the 2016 review. The fact that I'm here as a designated domestic violence death investigator, that was a special position that was created to enhance the investigations done with respect to domestic violence, bringing them all to one or two specialized coroners so that it's easier to identify trends and developments, and to engage and have ongoing relationships with stakeholders. We've also enhanced our investigative protocol so that the information we're gathering, I think, is more in line with, for example, the risk assessment tools and whatnot, so that going forward, we're better able to support and contribute to the evidence-based initiatives and prevention initiatives. So thank you.
That's great. Great, thank you. Deidre, you want to come back and try your sound again?
I do. Is this better?
Yep.
Excellent. Thank you so much, and my apologies. So a little bit about Ontario DVDRC, and you have that we were established in 2002 in response to recommendations from two high-profile inquests earlier in the 2000s. It's about a 10 to 18 member committee from across Ontario, and members include representatives from police, criminal justice sector, probation, parole, research scientists, corrections, activists, VAW agencies, nursing, and medicine. We have an OPP officer who prepares our cases for review, and we only review cases once the criminal justice process is completed. And cases are reviewed individually by the committee, so we don't have local police or service folks who were involved, family or friends. And we issue recommendations, sometimes repeatedly, and I absolutely concur with Myrna and Peter in terms of some of the issues we have with recommendations. What is working? Each case is reviewed in depth by a committee of experts, and that honors the lives of the victims. Sustainability is not an issue for us. It's a mandated committee with the Office of the Chief Coroner. And in a recent review, which I'll talk about a little later, everyone was unanimous that the committee should continue to live with us. And I think that's because that might be too much change, or if it ain't broke, don't fix it. We don't want to lose the funding or sustainability piece. And also because we have the unique authority to seize certain records. I would say one of our success stories, and I don't think any of us do this in isolation, is Bill 168, related to domestic violence in the workplace, and Peter talked about that, related to the murder of a woman at work by her male partner and colleague. So I think the inquest recommendations were helpful. I also think many, many, many years of violence against women activist work contributed to culture where that was timely and taken up.
Great, thank you. Over to you, Sara, some of your reflections on what's working well or needs to change, looking perspective from Saskatchewan and your efforts in that province.
Absolutely. I just want to start, this is my first time with everyone, so I just want to acknowledge that I'm coming to you from Treaty 4 territory and joining you from what is now called Regina. So thank you to everyone for starting us in a good way for this conversation. Part of the thought that was on my mind as I prepared for this conversation in terms of Saskatchewan's process. So for those of you who don't know, we embarked on our first domestic violence death review. It started in 2016. It took quite a bit of time to pull it together. I think more time than any civil servant was anticipating, which is not, that's not to be disparaging to any civil servant. That's just the nature of our work, I think sometimes. We released the domestic violence death review publicly in 2018, and then had to decide, where do we go from here? Do we continue or not? I'm pleased to, one of the things that's worked well in terms of our response to the domestic violence death review is that we've gotten confirmation and approval to proceed with another review, which is excellent news from our perspective. We'll do some lessons learned from the previous one and do some consultation. We also have the good fortune of being able to have a fairly multidisciplinary group, similar to Emily was talking about, and we're hoping to keep that. The other thing that we've committed to is that we will be including family members and loved ones as well in the process. And so trying to figure out how we do that in a really appropriate way, and hoping to glean some of the incredible value from that work and process. So that's a little bit about Saskatchewan. One of the thoughts that was on my mind was that I'm thinking about how, and I hate to use the word fortunate, but there's some really great timing going on in terms of this particular work right now. So in Saskatchewan, our first death review came out in 2018. The government responded to it and committed to working on all of the recommendations across the review. We've also had in Saskatchewan the good fortune of having one of our sexual violence agencies put together a sexual violence action plan for Saskatchewan. And although they're not the same work for sure, a bunch of those broad overarching recommendations around culture change are connected. So we have more than one report asking for similar making similar recommendations and asking for similar progress to be made. And then when you layer that on top of the national inquiry and how all of these pieces together are moving forward some of these more systemic things, that's been something that's been really, really excellent from our perspective. I think that we've made quite a bit of progress over the last 3 years, and this constant flow of recommendations and reports have been very, very helpful to that. I wasn't personally involved in developing the previous death review. So when it comes to challenges, one of the things that I experienced, so I work in government, I work as part of the Ministry of Justice. And one of the challenges that I've experienced is that interpreting the previous recommendations and reports is something that's been interesting for me. So one of our colleagues who works in the community sector, who happened to be, she sat on the committee, her and I were having a conversation a couple of months ago about a specific recommendation, and I had interpreted it very differently than she said the intent of it was. And so one of the things that we're thinking about is, how do we capture what it is, how do we make recommendations specific enough to be valuable so that there's not that room for misinterpretation later on when other people connect and don't connect or leave committees and leave the work. And at the same time, not make it so specific that they're not valuable in terms of spreading across broad sectors and helping people understand that this is really an issue that everyone needs to be responsible for. So those are some thoughts from me. I'm not sure if there's anything else that you need right now.
Well, that's good. We'll come back to you, but I'd like to hear from Stéphanie. Stéphanie, you have the exciting news that you just had your first annual report, and I know there was a lot of work that went in Quebec trying to organize the committee and get it going. And I'd be interested in your reflections about what's working well so far and what changes you might see.
Okay, so can everybody hear me?
Yes.
Is everything okay? Yes. Okay. Sorry.
Yeah.
Okay. Super. So maybe I can just start by first of all saying I'm very happy to be here with everybody, and I think it's very beneficial to hear everybody's perspective and how everybody's working with respect to these committees. Our committee was brought together in early 2018 following a very tragic death of a young woman of 18 years old. And I was actually the coroner responsible for the investigation of her death. And the death of this young lady actually really resonated within the population, because there had been police intervention the morning of her death. And so community organizations had been pressing government for many years to bring together a committee of experts. And with this very tragic death, this was really an occasion to really look at what actually goes wrong in some situations. And also, in terms of the coroner's work in Quebec, we in that specific situation, the person or the aggressor actually was going through obviously the criminal proceedings, and typically in the past, coroners used to basically draft very succinct reports in order not to interfere with the criminal proceedings, and that is actually a situation for maybe missed opportunities, because the coroner doesn't look at the whole situation. So in this case, we decided to look at it, and so that's what I did. And at the same time, this committee was brought together. So as is the case for Ontario, there's a lot of experts around the committee. There's about 20 organizations around the committee, so it's a very big committee. It's chaired by the coroner's office in Quebec. So there's always a coroner on the committee. And so there's police police participation. There's people from government, from the health sector, from the public security sector, and from justice. And so it's and there's also community members around the table, organizing shelters, women's shelters, and so it's there's a whole bunch of people, experts in the field. And yes, what was done in the first year was really creating a chart to look at the risk factors. And following that, there were 10 cases that were specifically looked at for the past, because this is an ongoing committee, so it's going to be looking at all cases for every year. But for the past, there were 10. So for the past, but contemporary situations. So for the past, there were 10 situations that were looked at, and that is the main factor of our first report. And that provided with 28 recommendations that were very, very favorably looked upon by the government. And there's one aspect in the report that we do mention, because obviously we look at statistics from every year, and year in, year out, there's about 10 domestic violence deaths that do occur in Quebec. And in 2021, very tragically, and maybe the pandemic has some influence on that. In the first 3 months of this new year, we have had 10 events where women passed away in the context of domestic violence. And so our recommendations that were presented in December really resonate with the government, and there is really it's been I'm sorry I'm searching for my words in English. There's been a lot of undertakings by the government to really look at this situation and really address the issue and look at the recommendations. So I think in terms of what's working well, unfortunately, the events of this year have really put forth the fact that it's very important to have this committee, and it's very important to have experts that look at the matter, and the 28 recommendations that were made will definitely help if in fact we can proceed with their implementations. So I think I would say that that's what's working well at the moment. It's that there really was a need for this committee. And in terms of changes, I think it's too early to say, but I think that what I can say is I think that for this committee to be successful also in the future, I think the dedication and the commitment of the members is not even an issue. They're very dedicated, and they're very committed to this work. I think there needs to be stability in terms of the people around the table. I think there needs to be obviously always a coroner around the table, and I think the challenges that we've seen are sometimes in terms of administrative support. So that's something that we struggled a bit during the last year, but now we've onboarded somebody that's very dedicated and that will help us with respect to that. So I think that's something that's going to help in terms of other success stories. So so that's what I can tell you for the moment about our committee.
Okay. That's great. I appreciate all your responses to those questions, and I think Myrna, you're going to introduce the next question, and we're doing well time-wise, so we may even have a chance to get back to some questions that are in the chat function.
Yes, thank you, Peter. And I think Stéphanie actually helped us transition into the second question, because she already addressed in the Quebec context some of the challenges in developing and sustaining a death review initiative. So maybe we can go around to the other four panelists to pose that same question. So what are the challenges in developing and sustaining your committee? And then in what way do you hope to plan for those challenges in the future? And maybe we can start with the same order that we had before with Emily.
So in regards to challenge, it was mentioned before, sometimes we do all that work and our recommendations aren't really followed through by either the government entities that we send them to, or private sectors. So that's one of our big challenges. In going forward, we do plan to try to balance more our committee by having more frontline workers and not only people in managers' position. Currently, we only have 2 frontline workers, and we've realized that that's something that we're missing to see really what the challenges is that they are facing on the ground, trying to help those victims of domestic violence. We are also planning on, I mentioned before, we do have a form to help coroners when they do investigations of domestic violence death. We are planning on changing that form, making more accurate, making more up to date, and we also are planning on rolling out a training for our coroners so they can recognize domestic violence. Because again, as mentioned before, when it's a case of homicide, suicide, the police doesn't always do as thorough of an investigation as they would in just homicide. So that's some things that we're looking forward to for the future, and I think that's it for me.
Great. Thank you, Emily. I think that's very interesting to hear about the form. Before the pandemic, I had started some work with the Statistics Canada Coroners and Medical Examiner database, and they're looking at, changes to the form too. So hopefully some of those changes can align that will better able detect some of the domestic homicides. Lori, I think you were next.
In terms of the way we do our aggregate reviews, obviously there has to be a period of time to elapse so that there are sufficient numbers to gather information and have any sort of meaningful data to work from. So, you know, a review in 2010, another in 2016, there has to be a period of time go by. And obviously statistically too, it's always difficult to know in terms, I mean, absolutely every death is one too many, but in terms of trying to capture systemic trends and understand what is potentially a gap in policy versus a gap in practice, that's always very difficult. So I think that's a challenge, and I'm so heartened to, yesterday, for example, to hear about the research and work with survivors, and I think, you know, there's tremendous opportunity there to interweave the information and results and observations coming out of the various death review panels and committees and the work that's being done with survivors. I think there's a tremendous opportunity there to really get the nuances of situations. So yeah, I think that would be the main challenge there in terms of our approach.
Okay, thank you, Lori. Deidre.
Thanks, Myrna. So in addition to the challenges folks have mentioned, we do have share some of those with recommendations, especially. What I'm wanting to talk about is our specific challenges, and I did mention who we had at the table, and I think one of our challenges is who is not at the table, and I think Myrna mentioned in her presentation that, you know, how do you get an expert in everything related to domestic violence? And so who is not at our table? And while I would love to be in a situation where we can't get every expert. So we are specifically missing northern and remote isolated community representation. We have no Indigenous representation on the committee right now, and that has not been, there's no designated membership places for Indigenous members, remote, urban, Métis, Indigenous, Inuit, VAW, and Indigenous policing. And the committee, in terms of diversity, does not reflect the cultural and ethnic diversity of Ontario. And then finally, experts in perpetrators or men who harm. So that's who's missing. And I think that's significant in terms of our work. And while there are folks on the committee who would approach the work with very clear gender-based power and equity lens, that's not necessarily true in terms of folks who are representing particular agencies. And that said, with a committee like that, and even with a committee that's even has a little bit of that, can be disruption. And I mean, for me, that disruption is very positive, but it is a tension. And that tension is not limited to a committee like this. It's definitely external and has a very long history, right? So between policing and the criminal justice system and VAW and activists, as well as VAW activists with an anti-Black, anti-Indigenous racism lens and the intersectionalities there. So definitely a tension between those folks in those communities, and that would be also present at our table. Finally, our other challenge is that we have a backlog of about 100 cases. Essentially, the cases referred exceed the number of cases we review in a given year. So we either need to have more meetings or we need to figure out a different way. So aggregating cases is one idea. The issue is we were in that same situation 5 years ago, and we did a 6-month project where cases were expedited in their review. And so here we are again, and that's because no real process changes were made at that time. And I think that that's a driver for some major process changes and review at this time. I think the other challenge is that this is high stress, trauma exposed work. And if you're on the committee, you're exposed. And if you're an expert, you're exposed. And this is another relatively new thing we've been dealing with at the coroner's office as well. And so it is something that we are absolutely challenged with on this committee. In terms of some of the we are changing, small process changes have included just looking at how we can perhaps do more cases per day. So having folks have their briefs to 3 pages in advance, their recommendations are previously crafted or they've talked to other folks on the committee, that longer discussions or recommendations that are being crafted in committee are often then taken offline and done after the group, and that the reviews are time limited, which then leads to me being an autocratic chair who rules with an iron fist in terms of trying to make sure that we aren't deferring cases that people have prepared, and that we're able to review the cases we've committed to reviewing. Related to the trauma exposure, looking at arriving and closing practices, and then looking at minimizing trauma exposure by the reviewer to the group. Right? So what's really necessary in order for the group to make recommendations versus in terms of the details of the deaths. We have a new investigating officer who is prolific. We actually had to cancel meetings last year because we didn't have enough cases ready to review despite a 100 case backlog. And so this fellow has been amazing, and we now have enough cases for review till March 2022. And that has enabled us to pick out a few themes so we can experiment with that. So we're going to have a couple of days for firearm related deaths, and we're going to have DV related child deaths as well. And that allows us to have a speaker and perhaps even seek out particular experts. The big change is a review of the entire committee, the mandate, the processes, the membership. That has been going on for just over a year. We are going to enter into a membership competition process. So folks are going to be invited to apply, and we are going to ensure that we have Indigenous representation, diversity that reflects Ontario's diverse population, and violence against women, agencies and activists, particularly with an anti-racism and anti-Black racism and anti-Indigenous racism lens. This review is including the literature, consultations with experts across the province, and it's going to look at the review process. And Peter and Myrna have actually done tons of work in, providing information on what other jurisdictions across the world are doing. Things we've heard from consultations, we could have more meetings, and the video platform necessity, because COVID, actually might make that standard, which would save us a lot on travel fees and maybe provide us with the funding to have more meetings. Do we do individual case review, which is what we're doing, or do we aggregate cases? Do we do local reviews versus expedited reviews versus a deep dive on particular cases? And the new members, the consultations have said that they need to be ambassadors for the committee and the recommendations. And then finally, having an audit committee, a subcommittee that would follow up on recommendations. Because we're challenged by, is this the right recommendation? Are these the right folks to receive the recommendation? And so on. And then with all of that, the challenge will be to manage change. So there's internal change and external change, just related to processes, but also in terms of the anti-racism, and gender analysis.
Yeah, so
Thank
it
you.
sounds like there's a lot of really great stuff happening in the Ontario Committee. That's wonderful. Lots of things to think about in terms of the progress that you've made over time and the progress that's happening. Sara, did you want to talk about challenges and planning for the future?
So I think, so there's, although there's difference in all of our process, I was just thinking about how much of what Deidre just talked about is similar to what was on my mind in the terms of this question. I think when we think about collaboration, especially amongst different human service professionals, we like to imagine like the Yale rowing team out on the water at 4 o'clock in the morning, just like swoosh, swoosh through the water. And in reality, it's like whitewater rafting blindfolded without a life jacket at the best of times. And so how do we all work together and figure out what collaboration means when we start from really different perspectives in terms of our professional values and how we see how we see each other and our roles and how that all fits together. So I don't think that's just a Saskatchewan challenge. I think that's kind of human nature generally. I think about things like even just differences in how we grow up in our professions. I think about many clinicians around like mental health clinicians who think about people need to be at a contemplative state in order to do the good work that they need to do to get better. How that lens is so different than maybe potentially a social worker's lens who works with individuals who might be experiencing or works with children experiencing neglect or abuse. They don't have the option to wait until someone's ready or at pre-contemplation or contemplation to work with them. And those dynamics together create a whole bunch of assumptions around what we think about each other as professionals. And so then you layer that on with historical trauma and historical relationships with police and those kinds of things. And then all of that is then layered again by the people doing the work around these committees, experiencing potentially vicarious trauma, being so passionate about like I think about how upsetting and angry it is to anytime we talk about one of these cases. And so you have all of these things going on at the same time, and it just makes collaboration just probably the most significant challenge. And how do we have the kind of relationships where we can say, I hear what you're saying, and at the same time, you need to understand all of my perspective around this, which is maybe different or I have a different lens than you. And then who has time for that, right? Like collaboration takes time. And so all of those things together summed up in collaboration, right? It's a big messy box of collaboration. That's what was on my mind.
Thank you, Sara. And I think, the collaboration is really one of the key aspects or the key characteristics of these death review initiatives. So I think it's interesting, thinking about what are the pros and cons of trying to do that and the resources and time that it takes. Stéphanie, I know that you touched on some of this. Do you have any last thoughts on the challenges or planning for the future in Quebec?
Yes, well, maybe I could add that we are also going to help the coroners within their specific investigations that will eventually be reviewed by the committee with a checklist that we're looking at in order for them to really understand the specific factors that they have to look at that may lead to recommendations within a private investigation that eventually will be looked at by the committee. So I think, the key word here is also collaboration, because I think the mandate of the committee, which is also to help and support coroners within their specific investigations, will probably will include that in the future, which is not something that has been done yet because it's such a new committee, but it's something that's going to happen, and it's something that we're going to obviously, encourage, because essentially, that's how we can grow as a committee, but as a society, if of course these recommendations are implemented, and that of course will be the challenge. And maybe next year I'll be able to tell you what successes we've had with these recommendations, because I think, the fear that we would have is essentially having this committee that year after year issues some recommendations and basically that they're not implemented. I think that would be, a tragedy because there's so many people that are experts and also that have lived through situations and that could bring something to a society, in our society in Quebec anyway, and that would make a difference. So I think all in all, I just see that our committee is evolving because it's just so young, and so it's not at its maturity stage yet, and maybe we will have the same issues as Deidre was explaining through the years, and so that's why it's so interesting to share our views and our experiences because we can only learn from one another.
Thank you, Stéphanie. Yes, I think, for people who are coming on to just the conference today and are having a first exposure to the initiatives that are domestic violence death review initiatives, I think this has been a great discussion in terms of Peter and I presenting what the characteristics are and what are some of the challenges and positive outcomes, but then hearing from you, the five of you, about what are some of the challenges and the positive things that have occurred in the context of the lives of your review initiatives.